Alright, so I'm going to do my video on part 3 of the lab, traction and myofascial decompression physiology. There are 4 questions. I'm just going to go read off the question and then give an answer to it immediately. So the first question is, in your own words, explain the impact of traction on the inflammatory and healing process. So with the traction, it's you're pulling back the head, and with pulling back the head, it creates those gaps in your between the vertebrae. So during this, it increases blood flow and decreases myofascial adhesion. This means that the healing and inflammatory process speeds up. Similar to heating a patient, it increases the blood flow, and increasing the blood flow, we've learned, speeds up all the process of the inflammatory phase. During this time, there are chemical mediators and more chemical mediators, more white blood cells, which means there are more that are released and there are more white blood cells that's able to go to the injured area. Second question is, in your own words, explain the impact of traction on pain. So kind of a similar thing of pulling the head back is creating those spaces between each vertebrae. This can help with the compression of the nerves, and this would be loose. The nerves would be loosened because there'd be less compression because of the space that's happening during the pulling apart. Also during this time, if you have like a sequestration lesion, it'll help the fluid kind of go back to its normal place and not outside, and the fluids will go back inside the disc. For the third question, it's, in your own words, explain the impact of myofascial decompression on the inflammatory and healing process. So during cupping, you're obviously going to get a lot of bruises wherever you're doing the cupping on, and as we know, with the bruising means there's blood rushing to the surface, to the skin, which means that there's more chemical mediators and white blood cells going to the area. And then lastly, number 4, in your own words, describe the impact of myofascial decompression on pain. Helps with putting with the amount of pressure on the nerve roots, there's less pressure, and then therefore it's going to help with, make sure there's less pain on the injured area.